Right now, most of the work is done based on whether or not the animals are, as it relates to GI nematodes, whether or not the animals are shedding eggs. That's an important part of the equation, but it's certainly not the whole thing. Unless we know which parasites that animal has, we don't have the whole picture. And in order to properly identify and treat, we have to come up with, use better technologies to do that. And one way is to use DNA-based technologies. We can't solve a problem if we don't know what the problem is. And just merely having an infection doesn't define a problem. Some of these parasites cause a lot more morbidity and mortality and pathogenicity than other parasites do. So if I can tell a producer, look, yeah, you have a parasite, but you know what? You really don't need to treat for this parasite because it's not going to contribute to problems dealing with poor weight gain or poor feed conversion. So, you know, you can avoid a lot of grief and a lot of money to treat them just by running a simple test. And if we can do that and guide you toward in a direction that saves you money and aggravation and time and doesn't do any harm to the animal by not treating them, you know, I think that would be a big positive. So yeah, all parasites are not the same. And this is going to become even a bigger issue as time moves on. With drug resistance is not the same either, at least geographically. If you go to places like Australia, down south, if you go into Western Europe, into the UK, it's a much bigger problem. And the parasites that they are dealing with there that are drug resistant, we do not have to deal with them yet, but it's coming. It's guaranteed to surface here in the United States, so we'd like to be ahead of the curve. So that's why we're also working on some tests to identify where drug resistance is. We're not there yet, but we're working on those tests as well.